Ladies and gentlemen, boys and girls, good morning, good evening, good afternoon, depending on when you're watching this. We are happy to be here. Welcome to Stawisha. Welcome to Stawisha Podcast. And this day is just special to us because tuko na mama yao. Na kama sio mama bado ni mama too. So thank you very much. We have a very interesting guest for you guys, and we hope you are going to learn, we are going to enjoy, we are going to get the insights. Importantly, if you do not remember anything out of this podcast, remember that your life matters and you're the only one who can take control over it. Karibu mama.
Thank you so much.
How are you this morning?
I'm very fine, and you?
I'm good.
Yeah, I'm happy to be here.
Happy to have you here. It's been a minute. We've been meaning to have this conversation, but then I think the Lord's time is the best, as they say.
Yeah, I've been having some competing tasks that I could not make it earlier than this.
Great. So we are happy that you came, and we are happy to have you here. And who is Mama? Tell us.
Mama is Mama. Mama is Zilper Imbuye. She works in the Department of Health, Siaya County, in the space of HIV prevention, especially among the AGYWs in Siaya County.
Somebody would be wondering, what is AGYW?
I know.
Ministry of Health, we have so many terminologies. Yes.
With a special focus for adolescents and young persons.
Adolescents and young persons.
Yes.
I hope an adolescent listening to us now is taking us serious, and because this is
I know they want me to define who is an adolescent.
Yes.
From our definition, we'll talk about 10 years to around 24 years. Yeah.
Adolescents and young people. How about what's your definition of a young person?
A young person is a person from 20 to 24. Yes.
Great.
They are more than adolescents.
What makes your work unique, according to you?
What makes my work unique is in the interaction with them. There is nothing we are doing without them. And as a county, we have realized that if we make them at the center of everything, we have been able to get their voices. For example, in Siaya County, when we were developing our adolescents and young persons action plan, they were the people at the center. Their voices is what is in our document. And when we are doing our reviews, we are still using them to give us feedback from what is happening during the implementation process. So that is what is making my program to be very unique. Because I just sit at the policy as they give me what to deliver.
Great. So young men, young women, boys and girls, wherever you are, talking about an adolescent, if you're an adolescent, it has just been defined. And think about it that there is a document that Mama has just mentioned. And this document is the Adolescent and Young Persons Action Plan 2028. Exactly. Do you know that that document exists? That is the first question. And then the second question is, have you interacted with the document? If you have not, we're going to try and put it in the link below so that you're able to get a link of what that action plan looks like, and you'll be able to appraise yourself and get to know. But importantly is that young people took part in developing this document. And Mama is still saying that young people still work with them. He sits at the policy, but then the young people bring in that which they think should be done or that which they think they need, and it's brought to their attention. So policy and service. How important is a policy?
A policy basically is a legislative document. And we think it is very important because when we work with our CSOs, community social organizations, and probably any other organization, they now become the bridge between the legislative document and the community. For example, like a day like today, we can talk about Stawisha playing a very critical role in our community, especially in Southeast Alego, whereby they are engaging the young girls and young women who have young babies just to take them through what is in the action plan.
Great. Do you think that so far as a county, we've done well in terms of ensuring that young people relate with this document and ensuring that whatever they had suggested within the document is undertaken or it's actioned on?
From where we sit, we have realized that the young people are playing a critical role in that by interacting with this document, part of the programs like prevention of new HIV infections, which is very high among the adolescents and young persons, and the issues of teenage pregnancies, gender-based violence, mental health, we have realized, like the other day, we were launching the initiative of injectable PrEP. And when we were doing our analysis, we have realized that most of our young people have really gotten the service. And it is a plus. That is the way to reducing new HIV infections, which has been on the high trends.
Injectable PrEP.
Yes.
A lot of notions have come with this. But then before we get there, as I put a pin to that, there is the aspect around accessing services. Young people, are our young people accessing these services?
Our young people are accessing these services. First of all, during the launch, we had a lot of documentary, and they're able to interact with it in the social media space to read more about it. And then we're also using peer-to-peer referrals. So if one peer gets a jab, they're able to interact with the other peers and also link. So it's called snowballing. One after the other, you identify yourselves with each other and you make referrals.
Ladies and gentlemen, boys and girls, there is the injectable PrEP. Have you tried it? Have you used it? Do you feel it's important? I think these are the questions that you should now be thinking about. And if you are at a high risk, then you really need to be able to liaise with the nearest health facility. Maybe you could just paint a picture within our county, or rather within our region. What is in terms of access to this injectable PrEP? Which are the areas where they can be able to? Just example.
For a start, Siaya County is among the 15 high burden counties in issues new HIV infections. So when we got the service, when we got the commodities, we started with only 10 facilities, just for a start to see the uptake. But from where we sit as a county, we have realized the youth are coming for it. And the commodities that we received, I think beginning of towards the end of March, we have already exhausted, especially the 6-month lenacapavir, and we're having few commodities remaining for the 2-month injectable, that is the Kabale.
Maybe just talk to that young person who's there and just let them know this injectable PrEP, who really needs it or who should use it.
Yes, our young people in Siaya County, we all need it because we are a majority of us are at high risk of acquiring new HIV infections, since most of us have not gone for the HIV test kit, which is the first step to know your HIV status. And we have also realized that the uptake of condom use, there is a lot of inconsistency, as majority come to report us to us issues of condom burst. So as you use dual protection with condoms, even if it bursts, then you are sure you will not get new infections from HIV. Again, I know when you come for the services of the injectable PrEP, we don't give it in isolation. We also talk about other preventive services on issues of teenage pregnancies, prevention of STIs, and also how to be resilient as a youth.
Teenage pregnancies, STIs, and a short while back, I think around 2 or 3 years ago, we had a study in two of our sublocations, and the study was looking at adolescent and young women under the ages of 24, and we were actually quite worried by the findings that under the ages of 24, close to 2,000 young people were either pregnant or with a child, or were almost getting pregnant from the analysis and from the questions and how they are able to respond. Could you kindly just paint a picture to us? What is the burden like? Of course, you are in charge of triple threat.
Yes.
Yes. So first, what is the triple threat, and what is the how do we look like as a county?
As a county under the program of triple threat, yes, we have the new HIV infections, we have the teenage pregnancies, and then we have issues of SGBV, and we also have the triple threat plus, where we discuss substance use. We also discuss issues of mental health. So when we talk about teenage pregnancies, I believe our document, we have two documents. We have the RAMCA Act, the 2024. Of course, that is also talking about accessing the SRH rights in our facilities. So this one, it has not been good. From the studies, we were at 21%, but when you look at our service delivery indicators, I think we are moving towards the right direction by involving the AYPs in our initiatives. So we are also seeing an increase in the contraceptive uptake, courtesy of our community programs, linking us with the CHPs and back to the facility. So when we look at our service delivery estimates, I think we are in the right direction. We are just waiting for the next survey to tell us how best we have improved.
Oh, great. So, triple threat, you'd be thinking you're so far away from it. You know about teenage pregnancy, right?
Yeah.
Yeah, that's under triple threat. You know about new HIV infections, right? That is under triple threat. So you know about gender-based violence, right? That's also under triple threat. So in terms of new HIV infections, are our youth the main rather, are they not really targets really, but how affected are our young people?
From the recent estimates that we have, the 2024 HIV estimates, we have realized as a county we are still contributing to high numbers of new HIV infections, and a bigger proportion, 40% of the new infections are still coming from us, the adolescents and young persons. The more reasons here was targeted with the injectable PrEP because we have also had some issues with the oral PrEP, though a majority are still for the oral PrEP. So we have the oral PrEP, we have the injectable PrEP. So we have all a variety of prevention methods. We still have condoms that we can still use with our youth just to ensure that the high burden of new infections are averted.
I was there at the launch of the injectable PrEP, and then there was a young man who's a fisher folk from Mageta Island. And I remember he was quite excited about this because he was talking about his work environment and the accessibility. Do you think work environments affect how our young people are able to access these services and products?
It does. It does, especially an example that you have given us on the fisher folk. Sometimes they want things that will not make them to come to the facility every now and again. They want something that when even if they go to fish in a long distance place, they are still safe. The nature of their work makes a majority of them to be at risk of acquiring HIV infection.
Yeah.
Yeah. So one of our facilities we targeted with this is some of the facilities along the beaches, and one of them is Mageta in the island.
Okay, great. But in terms of apart from the fisher folk, there's also been a rise of artisanal mining. Artisanal mining happens across our region. I think money is coming our way. I don't know, or money is going into the pockets of of the brokers.
Yes.
That is a topic for another day. But then, in terms of new HIV infections and in terms of uptake of services, say like the injectable PrEP and all that, is the department targeting people within those kind of areas as well?
Yeah, I think where we also have one of our sites called Ndori, and Ndori is known for quite a number of mining sites.
Yes.
So when we were considering facilities to start with, of course, ultimately all our facilities will be able to give the injectable PrEP. But as a start, we were looking even at the facilities that were having so many clients with oral PrEP that were complaining of its burden on a daily pill burdens, and even coming to the facility every now and again. So one of our facilities along the mining sites is Ndori, that has really done well in terms of consuming the commodities that they received.
Interesting. Allow me to take you back because you're quite passionate about about the work that you do, and of course we can already from the statistics from the data that you have and from what you are telling us as well, we can be able to tell that some good work is ongoing.
It is.
So my question is, what motivates you? Like, what's the fire behind it? Where did it start?
The fire behind my work is the success we get as a county, especially, let's say, issues to do with the HIV prevention. We start from the mother to child. We are a proud county to say that we were the first county to achieve the WHO target of below 5% of mother to child transmission, though we lost the gains. But together with our RAMCA Act, together with the AYP action plan, and together with now the committee of experts that we have with the AYPs, the formerly called TWGs.
Yeah.
The AYP TWG that we have as a county, the GBV TWGs, and we also have task force to just ensure that mother to child transmission is a big agenda in our county. So that really most motivates me, because each and every stakeholder feels they have a role in this. It's not left to one person. So if I get our CSOs are also looking at the data and they are also a concern, it really makes me happy. And also the leadership that we have in our department is also focusing on this triple threat, and they have taken it as a main agenda. Like our Director Public Health is our champion in ensuring that the vertical transmission of HIV, syphilis, and hepatitis B is actually doing well. Yeah.
Okay.
So those ones are the drivers. Those are the things that motivate me. And when I talk to young people, they are also using data to inform now their actions. Yeah.
Data is king, as they say. But then we are living in a digital space or in a digital environment. Now, my question is, how is the county, or how is the department incorporating the use of IT, or the use of digital technology in this space to ensure they enhance access to services and products? Is there a way?
There is a way, because we have a department in health dealing specifically with the digital health issues, digital health authority. For example, most of our facilities are now in the Taifa Care using the digital platform in terms of capturing data. And they're really appreciating it, because when it comes to reports, we don't lose so much of the data, as opposed to when we are using the registers. By the end of the month, there could be a rush due to shortage of staff, and they may not make simple errors. But when we use the EMRs, I think all data is safe and is able to be accessed by the authorities. Then when it comes to issues of now the other digital platforms, I think we are also working closely with some of the CSOs. Like we have the Mildmay Kenya International. They have a very good social network space. When we look at our CSOs like Stawisha, the Siaya Muungano, the UDI, name them. So quite a number of our CSOs are also having platforms to interact with the youths. And when we come to our CWGs, they give spaces, they give us feedback from what the youths are talking about in terms of service delivery. So that is also another platform that we really appreciate as a department. And we are seeing some of them are also going out of their way just to have even the documentaries that can be showcased beyond the reach of our counties.
Great. Talk about funding cuts. And when you talk about funding cuts, I know in the CSO, okay, in the CSO space, I know we were affected and we take responsibility for the effect.
Yes.
But then I would just want to know, do you think that, was the department affected with the funding cuts? Especially we had the USAID, and I know that
We had the
the
USAID, we
donor
had the
space is also
PEFA, we
shrinking.
had the other partners in space. And that is the order of the day. And I think as a department, we try really that services that were offered by partner supported staff are currently integrated. A lot of sensitizations are being done to our staff just to ensure that any program is integrated, so that issues of human resource, as much as we are still hit, but that one staff is able to offer comprehensive services, even responsive services to the adolescents and young people, which has always been a challenge. I think through the department, we have trained our staffs on youth responsive services, which has been a major milestone. The other thing we are doing with the funding cut, you realize that as the funding cut was also there, we are also having these issues of SHA. And
Yes.
Facilities are able now to have some funds,
Yes.
courtesy of SHA, that can help them deliver some of the activities like commodities. They're able to conduct outreaches, which were majorly were being supported by the programs. So for us, that is again another milestone. Though we are not doing it optimally, but in a to some extent, we are in that trajectory.
Great, because you've just answered the other question that I was meant to ask, because we talk about partnership, but then again, we also talk about sustainability, because as a department, you are what we are calling a going concern prospect, meaning you're not closing shop tomorrow or the day after.
We are not.
Yeah, it is assumed that you will always be there forever, and you're going to make your services better and better. And I'm glad to note that you are integrating these services, that the services are not falling off just because a partner has left. Because that is quite, ladies and gentlemen, it's always a good feeling, even as a partner, that when you support a cause, that even in your absence, you still get reports that whatever you started is ongoing. It speaks well about the people you worked with. It also speaks well about you, because think about it, you don't want to put your money in a place where you will not be able to follow through, in a place where you will not be able to see it beyond your actual presence. So we will be opening the space down on our comment section for any person or any young person with a question, and even the parents of these young people. But then as you're heading there, my question is, how important is the involvement of parents in ensuring that the triple threat goes low? Parents and caregivers, how important?
Yeah, that has also been a key area, especially in the line of triple threat. So we have been having a lot of intergenerational discussions as a county in our facility, whereby we have parents coming on board, and sometimes we also bring both parents and the AYPs just to discuss issues and to reach a consensus of how the initiatives are changing day by day. So the intergenerational talk is the way to go. And we also appreciate that our CHPs, the community health promoters, they talk both to the older generation and they also talk to this younger generation, and they are able to bridge the gap. So as a county, we solely rely on our CHPs to give us the myths and misconceptions, so that we also see how best do we handle this when they come to the facilities.
Are young people listening, according to you?
Young
are they
people,
listening?
Young people are listening because as a county, apart from CHPs, we also have the YACHs, the Youth Advisory Champions for Health, the younger people that come to our facilities and have a dialogue with our facilities, so that if there is any element of non-youth responsive activity, we are able to support.
Yeah. So, ma'am, we were talking about you of course at every point the department wants to involve the young people, and the information is being shared out there. But then the big question is, are our young people listening?
From where we sit, we believe our young people are listening, because we have quite a number of platforms. We have the Tiras, we have the TikTok, we have other avenues that they can get this information. We have really made our information to be accessible, and even our Ramka Act is on virtual space. They can access it. The AYP action plan, what is required of their responsibility and our responsibility, is all embedded in the documents that we normally share.
Great. So we are being told that we have very key documents, especially that speaks to our health as young people within this region. We have the Ramka Act, and we also have the AYP action plan. AYP, remember guys, we said adolescent and young persons. So adolescents and young persons have a document within this county that we rely on as CSOs and even as the government to be able to address the needs of our young. Abreast yourself with it. We're going to put the links down in our comment section, so that you can be able to check them out. And more than that, also, we are thinking about having you get involved in this kind of spaces. How involved are you? And how responsible are you? We talk about taking responsibility. We talk about service. We're also talking about from time to time, it's costly, but health is costly. Anything good is costly. That's for sure.
You have to take time and seek services.
But then the question is, platforms that have been established by the government and of course by the department, in terms of even the services being offered, are these services under sexual reproductive health free SRHR services? Are they free entirely?
The services are free because when we have the SHA
Yes.
under the primary care networks, so once you have registered, we are just encouraging our adolescents and young people who are 18 and above to register because now they have an identity.
Yes.
And the younger ones, 10 to 14, 10 to 15, they're about 17. Let's ensure that we have the birth certificate so that we benefit from our parents' initiatives of registration from SHA. So from where we sit, once you are registered under PCN, we can say, yes, we don't need out of pocket. The challenge is, what are we waiting for to get registered in this SHA or SHIF? That is an encouragement. So we may not cost anything as long as you are now registered. And it is a very good option. It's cheaper than out of pocket treatments.
Another question that is in relation to that, we have injectable PrEP. For me to be able to, for example, I've gone to the facility and I want to get that injection. Must I have registered with SHA for me to be able to get it?
Under PCN, yes, it's good to have been registered under SHA, but under prevention of HIV services, you'll get the HIV test kit for free. You'll be tested for free. If you meet the criteria, you'll be injected. But we are encouraging that you be part of the data under SHA for us, for the facility to be able to claim outpatient services.
Inpatient and outpatient services. I don't know when you last got into an hospital and you got either of the services. But then for a very long time, I really didn't get the distinctions about inpatient and outpatient. And thank God for some of the facilities we have around. When you least expect it, a disease can come. When you least expect it, you may need the services of a health facility. And remember, we've been informed that right now the facilities have a way of claiming these outpatient services. And when they're able to claim, that is when you go to your country, this I'm now talking to the global community.
Yes.
You go back home, or rather you get a phone call from home, somebody is telling you they're sick, and they require you to do what? To send money. Actually, seeking medication through cash is very expensive globally, in Kenya or in America or whichever place. And I don't want to mention some parts of the world where people are resorting to self-medication because they've not paid for their health insurance. If whenever you can, please make a point of supporting even those that you have within your household so that you don't have to get into your pocket again and pay directly when they need medical services. And when you are called for those small fundraisers because somebody did not do what? Did not have a medical cover. You have farmhands, you have house helps, you have people that you work with, you have colleagues. I challenge you to just ask them what is their SHA status, what is their SHIF status. Are they ready for any eventuality? Disclaimer: I'm not here paid by government to announce that. I'm just here to sensitize you, because it's very sad that from time to time we are called to come in and support our friends, our family members, when there was an opportunity for them to take charge of their health and be able to do what? Be able to just pay the little amount for SHA and get the medical service. As we come to the close, what is that advice that you'd give a young person who's at his or her prime right now, in as far as your area of interest, that is the space of triple threat, is concerned? What is it that you can tell the young person, and what is it that you can tell a guardian or a parent of a young person, and what is it that you can tell the civil society organization? Those three areas.
Especially the parting shot under triple threat, the HIV prevention arm, JIPENDE-JIPREP.
JIPENDE-JIPREP. Umesikia wazee? JIPENDE na UmejiPREP.
Yeah. For the other, like for the contraception and the other SRH services, kindly take responsibility. The services are accessible. This is the only county where all our facilities are less than 5 kilometers from each other. So a distance is not a barrier. Be responsible for your health. For our guardians, let's engage more in the transgenerational talks so that we are able to know how to mentor the younger generation. To the CSO, we want to thank you so much for the good work you are doing in collaboration with the department to help us achieve the the reverse of the triple threat indicators as a county. Thank you, young people. Thank you.
Asante sana, and thank you for your time. We don't take it for granted. We are honored. And ladies and gentlemen, we come to a close of this, but this is just the beginning. We look forward to more engaging series on the various aspects of Stawisha. Stawisha Africa Initiative, as we already know, is an NGO, and we have 3 thematic areas, where the area 1 is education and skills training, area 2 is food security and environment, area 3 is health and wellness. So are you healthy? Are you well? Adios. Thank you.
Thank you.
Thank you for listening to the Stawisha Africa Initiative. Your growth, our concern.